Hello, everyone, and thank you for joining us for Virtual Pathology Grand Rounds, which is being held today as part of the pre-meeting virtual sessions leading up to the ASCP 2022 annual meeting. I'm Raul Gonzalez, part of the VPGR team, and I am proud to introduce our speaker today, Edna Garcia, MPH, who is the Senior Director of Scientific Engagement and Research at ASCP's Institute for Science, Technology, and Policy in Washington, D.C. She works with both the Washington, D.C. and ASCP Chicago staff on the development, administration, analysis, and reporting of high-profile surveys and workforce studies. She also manages the implementation and operation of the organization's Choosing Wisely campaign, the Workforce Steering Committee, and other laboratory workforce initiatives. She also represents ASCP at external meetings, committees, and events for other strategic key organizations and government offices relating to pathology and laboratory medicine. She has authored several publications related to pathology workforce topics and related issues. And with that, we are very fortunate to have her here to speak with us today. Thank you.
Thank you, Dr. Gonzalez, and good afternoon, everyone. Before I start, I would also like to thank the ASCP's Virtual Pathology Grand Rounds team for giving me the opportunity to present to you today the ASCP's current lab workforce activities. So for this presentation, I have nothing to disclose. So today I will set the scene by talking about the current landscape in the field of lab medicine, followed by some data and updates from our wage and vacancy surveys and the impact of COVID-19 in the lab. I'll also share some data from the Board of Certification with the current research that they just published, as well as some of our own ongoing research and advocacy efforts. I will then share with you the outcomes from our most recent study that was published with the University of Washington's Center for Health Workforce Studies group that led to the development of our Blueprint for Action. And lastly, I will provide updates on our next steps in our workforce initiatives. So I would like to start with this diagram that I borrowed from Pat Tanabe, who is our past BOC Executive Director. And this slide shows an excellent depiction of why we're having challenges in recruiting qualified lab personnel. The effects of the lack of visibility and careers in the lab starts in the educational system and affects recruitment of students in lab training programs. The profession also encounters regulatory issues and an aging workforce. Though our current data shows that that average age for lab professionals is 42 years old, and this suggests to us that those who anticipated retiring in the past 5 years have already retired. Now I would like to talk about the common trends and the challenges faced by the lab field that we've seen from our wage and vacancy surveys. We've been conducting these surveys for 33 years. And in those years, we reported on the need for higher wages, the need for qualified lab personnel, some regulatory issues, need and access to training programs, addressing burnout and job satisfaction, and in the last decade, an increased need for diversity. Recently, however, we've also seen from the results of our studies that trends have changed due to these three major events, which are the Great Recession, the COVID-19 pandemic, and most recently, the Great Resignation. And these events have transformed our workforce in that we've seen higher retirement rates during the recession, where we lost a lot of lab professionals with years of skills and experience. And at the height of the COVID-19 pandemic, we've seen decreased testing, furloughs, hiring freezes, and difficulties finding clinical rotations. And 2 years later to the present, we're now seeing increased testing, but also higher than normal vacancies, where we saw a lot of lab professionals leaving, not only due to retirements, but also switching careers at an alarming rate compared to the data we've collected pre-pandemic. We also found higher rates of burnout overall, with reasons being increased workload, again, the pandemic, supply chain issues, work-related stressors, poor work-life balance, and according to our most current research that I will talk about more later on the impact of culture on burnout, we've seen representation burnout among underrepresented minorities, which also contributes to staff departure. So before I share some data, I want to provide some updates on our current surveys that have recently closed. The Wage 2021 survey report has been accepted for publication by the ASCP with an expected release of mid-September of this year. And this survey is different from the other wage surveys we've deployed because we incorporated questions about the impact of the pandemic on lab professional salaries. The vacancy survey 2022 closed in June of this year and is currently in the analysis phase. And back in 2020, we began collecting data on the impact of COVID-19 on staffing. And we plan to continue including these questions every 2 years so we can create trends on the effects of the pandemic in the lab. The most current survey closed in March of this year and is also in the analysis phase. So from these surveys, we collect data from 14 different occupational titles, 19 different facilities, and 17 different departments. And while I cannot share with you in-depth data on wages until the report is published, I'd like to share some wage-related data from the survey. And one of the questions we asked was, how has the pandemic altered your salary? And this table shows that over 80% of the survey participants reported no change in their salary during the pandemic. And many of our research on this topic, as well as some news outlets, have reported on the significant contributions of the field of pathology and lab medicine at the start of the pandemic that continues to this day. And yet, lab professional salaries have shown no significant increase in the past 2 years. We also asked our survey participants if they are presently experiencing burnout. And for this question, we received over 9,000 responses, and over half reported presently experiencing burnout. We found that this rate is higher compared to when we asked the same question back in 2018. And we also asked if they considered making job changes as a result of feeling burned out. And the majority of our respondents indicated that they're looking into a similar position in a different clinical laboratory, followed by changing careers completely, looking for employment in a related field, and lastly, retiring. I also want to show some preliminary data on the impact of COVID-19 on staffing survey that we launched this year. Specifically, survey respondents' answers to the questions regarding supply issues, contract staff, and recruitment. As I mentioned earlier, we launched this survey back in 2020 at the height of the pandemic to determine how COVID-19 is impacting the lab in terms of staffing and vacancies. And our goal is to continue asking these questions every 2 years with the approval and input of the ASCP's Commission on Science, Technology, and Policy. So on the supply issues, over half of our respondents reported having ongoing difficulties obtaining supplies. Compared to 2020, there has been a 15% increase in the rate of labs experiencing supply issues. And just as a side note, I would also like to share with you that the ASCP's Effective Test Utilization Steering Committee also conducted a lab supply chain shortage survey this year to help understand and quantify the scope of supply chain issues in the lab. We surveyed both the ASCP Choosing Wisely Advisory Board and the entire ASCP membership. And the results from this survey show that in addition to shortage in lab materials, supply chain issues also take away critical time from diagnosing cases. And many participants indicated that when using alternative supplies or methods, they scramble to do validations and procedure changes and training on the fly, which leads to delays in reporting. Staff time also gets divided between validating alternative supplies and performing testing, which leads to the disruption of workflow, stress, and burnout. And they also mentioned that outsourcing tests to other hospitals were common due to lack of lab materials to complete tests on time. And this survey was a follow-up to the editorial some of the members of the Effective Test Utilization Committee, Steering Committee wrote in ASCP. And Iman can share both links in the chat box if you're interested in reading those. So under the topic of contract staff, we see that there has been an increase in daily utilization of these types of lab professionals from 51.2% in 2020 to 66.6% in 2022. We have also always collected data on traveling professionals in our wage surveys, but only in the past few years have we seen these numbers rise significantly. And we added this third question, a new question in the survey of how has your laboratory experienced issues with recruiting staff in the past 12 months? And over 80% of our respondents reported that they are having issues with recruiting staff in the past 12 months. So with that, we also wanted to know what types of recruitment strategies are being implemented at this time. And we asked an open-ended question on this topic. We received over 1,300 comments, with the most common strategies being providing sign-on bonuses that range from as low as $5,000 up to $20,000. Some of the strategies reported were also advertising on various platforms, for example, job sites and posting at universities. Again, hiring of traveling lab professionals, and also hiring applicants with non-lab specific degrees, such as biology or biochemistry. And I also wanted to point out that despite these strategies, many of the respondents also commented that they experience extremely high levels of staff leaving due to burnout despite overtime pay. Some are unable to recruit permanent replacements and partially supplementing staffing with expensive travelers who also leave due to the nature of their contract work. Many have also been unable to recruit sufficient number of temporary employees despite generous contract pay. And some have been operating below minimum staffing levels despite the hiring bonus that range from $2,000 to $9,000 for each vacant position, and also despite employee referral incentives offered that range from $200 to $2,000 for each referral that results in candidate hire. And in addition to asking about recruitment strategies, we also asked an open-ended question on the type of retention strategies labs utilized. And we also, again, received over 1,300 comments on this one, with the most common being retention bonuses. Though according to the respondents, this amount is not as much as the recruitment bonuses being given by their institutions. There are also salary increases and incentive pay, where respondents reporting having received a 5% cost of living increase and around $500 to $5,000 retention pay. There's also critical pay and pandemic pay, overtime and bonuses, flexible hours. And lastly, many also said that their labs or institutions do not provide any retention benefits. And I'm going to talk more about retention strategies later in this presentation, but I just wanted to mention that for many of our study participants, Staff well-being offerings is also an important retention strategy, but most of the time overlooked. In the past, we've also seen many strategies on recruitment, both in lab training programs as well as employment, but there are no extensive list of strategies when it comes to retaining the lab professionals that we currently have. And so we suggested in our past reports that both recruitment and retention require the same focus and effort. So these are the studies that we are currently analyzing and waiting on for publication. Sorry, my light turned off. We will share the reports to you once they are released. And some of you may have read this report from the Board of Certification, but I'd like to share some highlights on the data about lab training programs. This published report was authored by the ASCP's Board of Certification's Research and Development Committee. They launched 2 surveys of the medical lab science education programs, one for program directors and another for the program itself. And these reports were a follow-up to the survey of MLS education programs conducted in 2016. Give me 1 second. Let me just turn this light off because it turned off. Oh, sorry. I apologize about that. And so the purpose of the surveys was to gather information to support MLS program directors and faculty in educating students, especially to clarify current issues and reveal trends that may impact future program resources and the quality of MLS education. Specifically, these surveys were designed to provide data to support strategic planning, funding requests, evidence for grant applications, workforce issues, and policy assessment. So for this presentation, I will only be talking about the lab program report. And for this survey, they received 111 respondents. And the report shows that the majority of programs reported a 5-year average of 20 to 29 applicants. 20% of university programs graduated 30 or more students per year, while all hospital programs graduated fewer than 30 students per year. The majority of university programs and hospital programs also reported having 0 to 5 faculty members and have no open positions. And with regards to clinical sites and rotations, there were large differences in the lab disciplines available as clinical training sites. And in general, the university program directors responded that adequate numbers of clinical sites were available for chemistry, coagulation, hematology, immunology, phlebotomy, specimen processing, and urinalysis training. However, both university and hospital program directors indicated that the top 3 programs they're having difficulty obtaining clinical sites were microbiology, blood bank, and molecular diagnostics. And they also reported that the greatest barriers to obtaining adequate clinical sites, and this was identified by both the university and hospital programs, were staffing, competition with other programs, and time. Other common obstacles that they reported were geographic locations, increased in workload, lack of physical space, budget, administrative support, and personal reasons. And some of the additional challenges noted by university program directors also included contracts, regulatory limitations, and the value of the program not being recognized. So as determined by the 2016 survey of the MLS programs, sites for clinical rotations in micro, blood bank, and molecular diagnostic rotations continue to be in greatest demand. And this is a major factor in limiting the number of graduates, according to this report. So taking steps to overcome these barriers was common among university programs and included sending students to multiple clinical sites and also sharing clinical sites among multiple students. They also reported that the number of online courses and programs offered by universities has substantially increased since 2016 from 20% to 41.7%. And they saw a slight increase in shorter duration of programs that may reflect adjustments made due to the pandemic. And this may or may not reflect an ongoing trend. So in addition to the studies I shared with you, we also have other studies related to workforce conducted by our colleagues and summer fellows from our institute here in DC. One of them is the impact of culture in combating burnout. And our goal was to capture data about culture, burnout, diversity, equity, and inclusion, and wellness from medical lab professionals during the pandemic. And we utilized a cross-sectional survey design, which was originally our phase 1 back in August of last year. And but since the pandemic continues to affect the field in so many areas, we plan to turn this into a longitudinal study, which is where phase 2 has come in. Our team leader for this project is Dr. Loti Mulder, who is the ASCP Director of Leadership and Empowerment. And we plan to submit this report for publication this year. Another important research and advocacy activity I would like to share with you comes from the ASCP Foundation's Carter Stephen Ainsworth Health Policies Summer Fellowship. And this summer fellowship offers students the opportunity to serve as ASCP health policy interns, working primarily with us here at the Institute, and where they receive hands-on experience and insight to the synergies of science, policy, and practice in lab medicine. And the workforce projects many of our fellows have taken on were on the topics of salaries and gender, DEI in the lab, as well as rural areas and the lab. The most current project that we gave one of our fellows, and also timely, is the topic of loan forgiveness for lab professionals. And this project was completed by Haley Malden, who is currently working on her Master's of Science in Public Health in Health Policy at the Bloomberg School of Public Health at Johns Hopkins University. And at the time she was our fellow, she was also working as a part-time medical lab technician. And before I delve into her research, I just want to mention that we applaud President Biden's announcement on student loan forgiveness. This has been part of our advocacy agenda, and we hope that this comes into fruition. But we also continue to advocate for the inclusion of lab professionals in already established federal loan forgiveness programs that are available to physicians and other allied health professionals. So Haley found that of the 9 major federal student forgiveness programs that are available for nurses, 8 of them are available to physicians. But when looking for options for lab professionals, only 4 of these programs are applicable. And to make a relative comparison, she also looked at pharmacists, and 6 of the 9 programs that are federal programs are available to them. And so for the federal programs that are available to lab professionals, we have the Public Service Loan Forgiveness, the Indian Health Services, Faculty Loan Forgiveness, and the CDC Lab Leadership Service. And from her findings, she concluded that lab professionals are overlooked for loan forgiveness programs. And in addition, lab training programs are also not eligible for HRSA grants. Lab professionals are predominantly women, especially the lower paying positions, and women have higher average student loan debt than men. And as the field becomes more diverse, more members could have higher student loan debt. And she indicated that confronting this issue from multiple levels will make more contact with policy decision makers, and conducting more research will provide us with more comprehensive view of efficacy. So after thoroughly looking into the options available to our members and the field at large, she added 3 recommendations specific to loan forgiveness. And our advocacy team continued to look at this, but one of her recommendations that could open a lot of doors is with HRSA to expand their definition of eligible professions to include lab personnel and HIPSA, which is the health professional shortage areas. And at the state level, she recommended creating an advocacy packet for members with pre-written letters and materials to send to their state level representatives. And there were a few states that had programs in the past that benefited allied healthcare workers. So it could be useful to start with states such as Illinois or Wyoming that already have the framework for these programs. And for ASCP to continue to conduct further research about the need for a program that would reduce the burden of student loans and the effectiveness of the current programs at a state level. And we do continue to advocate for loan forgiveness as well as scholarships for lab professionals. And with that, I would like to move on to our most recent published study entitled The Clinical Lab Workforce, Understanding the Challenges to Meeting Current and Future Needs. Some of you might have read the report already, but I just want to give a quick presentation on our findings and how this study led us to the development of the ASCP's Blueprint for Action. And for those of you who are not familiar with the University of Washington Center for Health Workforce Studies, they house 2 of 9 health workforce research centers across the country, funded by the National Center for Health Workforce Analysis at HRSA. And each of the health workforce research centers focuses on a specific aspect of the health workforce. And they address the allied health workforce, as well as health equity and health workforce diversity. And this is the first time they've actually worked with and explore the field of lab medicine. So it's really exciting for both of us because they are learning a lot about our field, and they also help us with the visibility of the profession. So to better understand lab workforce needs, both groups, us and the University of Washington, conducted a study among lab professionals, and the UW team conducted a one-on-one key informant interviews via phone. In total, they had 16 semi-structured key informant interviews. The ASCP, on the other hand, conducted 10 focus groups among current lab professionals and educators. And our study used a semi-structured protocol with discussion questions based on current workforce-related literature. The aims of the study were to first identify how stakeholders are currently addressing recruitment and retention for the workforce. And this includes attracting students, filling vacancies, as well as identifying qualified lab professionals. Second aim was to identify the barriers and facilitators, as well as factors contributing to successful models for recruitment and retention. Our third aim was to develop recommendations to address these barriers and facilitators, and that includes education and training, credentials, employment, environment policy and regulation, as well as marketplace issues. And lastly, our last aim was to develop a strategic blueprint of interventions based on these study findings. And in this study, we examined 4 roles that require less than a bachelor's degree, as well as 2 occupations requiring a bachelor's degree or higher. We focused on these 6 occupations, but we also recognize that these are not all the occupations involved in the lab, and some others are more specialized. So in the next few slides, I will briefly talk about the most common challenges and strategies utilized by lab academic institutions, as well as employers in the areas of recruitment and retention, diversity and inclusion, as well as their response to COVID. So this table shows the different types of challenges labs have when recruiting lab professionals. And our focus group results show that various institutions across the country use similar strategies to solve employment recruitment challenges, which are the recruitment outreach and offering financial incentives for these 4 occupational roles. So labs also face challenges retaining personnel, usually because of competition with other labs that have better offerings, for example, large sign-on bonuses. And according to our participants, their institutions mostly offer financial incentives, followed by promoting positive workplace culture and flexible schedule to retain their staff. And for academic recruitment, the program directors from all 4 groups had similar challenges with the lack of training programs, as well as resources for their program. And their main strategy was to raise awareness through recruitment activities. I would also like to point out that most of their recruitment focus are geared towards high schools, community colleges, and universities. And also most of the activities occur only once a year, mostly during the summer. And findings from our informants highlighted the need to promote diversity and inclusion. And our study indicates that currently there's scant evidence on diversity-related programs or initiatives. And I'd like to point out that while the majority of the HD groups in the lab indicated not having targeted strategies for diversity, those that did reported having resource groups, diversity training, as well as task forces. They also reported that many employers are currently in the discussion phase on the topic of diversifying the workforce, mainly in the form of diversity work groups or leadership meetings, where labs are starting to recognize the need to develop strategic plans to reach out to underrepresented communities. Many training programs also have outreach activities in underrepresented communities when recruiting compared to lab employers. For MLTs and training programs, while the majority of our MLT participants reported not having enough targeted strategies to promote diversity, those that did had outreach activities or financial incentives for students from underrepresented groups. And so from both the focus group and the phone interviews, 3 focus areas were identified where there are opportunities to improve recognition of the lab workforce, as well as enhancing careers in the field. And they are to improve visibility of the clinical lab occupations, improving recruitment and retention, and putting enhanced focus on diversity and inclusion in the laboratory. And we found that there is evidence that the lab workforce shortages will likely increase in the near future due to increased demand for lab services, diminished education and training opportunities, as well as barriers to recruiting and retaining lab professionals. And the results from our study strongly suggest solutions-based discussions. Our results also emphasize that meeting the future workforce needs will require actions by and collaboration among education and training programs, employers, as well as professional organizations. Our report also states that the pandemic has increased the urgency of ensuring a robust and flexible lab workforce so that we can meet the growing patient demand, and we should use this opportunity to promote the visibility of the profession. And if implemented, we believe that these actions will likely contribute to the increases in the availability of lab workforce supply and also strengthen the pathways into lab careers long into the future. And on the left is just the link to the full study that Iman can also share in the chat box. But on the right is probably something that not many of you have seen. This is a policy brief. The link is over here that Iman can also share, developed by our partners at from UW. The lab profession, we received an important boost of visibility as the focus of an important policy brief for a division of the US Health and Human Services Department. The UW recently published this policy brief on the lab workforce as part of a series of reports on the impact of the pandemic on various allied health occupations. And just as a background, this report is targeted towards policymakers, planners, educators, as well as clinicians, and others with an interest in the health workforce. And it also provides a general overview of the lab workforce and our role during the pandemic. It also describes the state and national approaches for emergency increases to the lab workforce. And again, as I mentioned, this brief has been submitted to HRSA, and ASCP is developing an action plan based on this report. So based on the study results, we developed a blueprint for action that summarizes the needs identified from the report and also recommends actions to address the challenges and barriers associated with these needs. We developed 9 core recommendations where each activity includes key actors, target audiences, as well as suggested tasks. And I also just want to note that each recommendation has a number of sub-recommendations, also with key actors and suggested tasks. And the recommendations 1 to 4 focus on increasing the visibility of lab occupations. Recommendations 5 to 7 focuses on expanding and improving workforce recruitment and retention. And recommendations 8 to 9 will focus on increasing the diversity and inclusion of the workforce, lab workforce. And here I just wanted to show a diagram of how we envision us working with key actors, starting with the lab community, which comprises lab employers, lab training programs, lab professionals and students, as well as specialty lab societies. We also recommend working with professional societies, organizations, and institutions that may or may not be lab related, but could potentially help us advance the goals of the workforce initiatives. We also added here government institutions such as the CDC, BLS, HRSA, Department of Education, Department of Labor, as well as CMS, pretty much all of the alphabets. And another important partner would also be the academic community, from academic to school administrators, guidance counselors, STEM educators, high school students, middle school students, as well as early as elementary school students. And lastly, to increase our focus on DEI in the lab, we recommended partnering with underserved community organizations that would help reach priority communities. So these are the groups that we hope to all partner with to promote our initiatives. So what are we doing now since the publication of the report and the blueprint for action, and what are our next steps? I will start with the BOC. This was shared again with us by our past executive director, Pat Tanabe, and she indicated that in March of 2020, lab program students had to leave their clinical rotations and also leave campus. And in response to the disruption of the programs, they compiled the document Resources for Program Directors to help support programs and students during the transition to distance education. And they're also planning on conducting a survey on the impact of COVID on examinees. And this will both go to students and program directors with the topic areas such as education, clinical rotations, exam prep, finances, and mental health. And the survey is to be administered this summer. So watch out for that. And also many of you might have heard about the formation of the ASCP's Workforce Steering Committee. This steering committee was formed in February of this year, but to serve as the strategy drivers for the program by initiating discussions and taking an active role in calling attention to the 3 focus areas that I mentioned earlier. But this group is also tasked to develop an implementation plan that addresses the top priorities, including short and long-term goals. We put together this members list by reviewing the ASCP volunteer database. We sought recommendations from active member volunteers, and we made sure that the group represents the different occupational roles in the lab. We also made sure that we had educators and administrators, pathologists, as well as researchers and advocates. And with DEI in mind, We also took into consideration the representation by gender, race, ethnicity, age, and sexual orientation. We held our first meeting in April, and we've had 2 other meetings since to discuss the prioritization and ranking of the 9 core recommendations from the blueprint. And our chair is Dr. Susan Harrington from Cleveland Clinic. So guided by this blueprint and the study, our goal is to also put together a national coalition of individual and organizational partners representing a wide range of key actors and audiences that will work together to address the lab workforce's current challenges and future needs. And we look forward to building those partnerships to achieve our shared goals. Currently, we've had discussions with partner societies such as ASCLS, NSH, ASM, and APHL that our chair will also present at the annual meeting in person workforce session. She will provide more details on that. We've also had calls with a number of lab training programs, as well as meetings lined up with other potential partners. So in addition to the Workforce Steering Committee and coalition discussions, ASCP is moving quickly to implement some of the recommendations in the blueprint. We've launched a multi-year campaign designed to improve visibilities of careers in the lab. We've been working with Media Planet to feature careers in lab science that appeared in USA Today and online last year, and there's another one this year. We've also interviewed multiple public relations firms to assist our communications and advocacy efforts. And we also continue to develop industry partnerships to assist with implementation and coalition building. And we believe that we must strengthen the pathways into these careers if we are to succeed. And DEI is one of the keys to our success. Our hope is that through the implementation of our recommendations and partnerships with key stakeholders, entry into the lab will become commonplace and not just the profession that comes after a student takes a deep dive into all of the other options. And we want to encourage consideration of careers in science, but the lab profession should be visible and more easily accessible. We also believe that efforts to promote visibility of the workforce must be accompanied by efforts to improve workforce recruitment and retention. We have to be clear about the educational level and training required for each role, as well as the types of tasks and functions that they perform in healthcare. The complexity of the field should not be a barrier. We must also highlight how lab professionals contribute to patients' health, and we must also work with health systems and employers to improve the salary of lab professionals. And lastly, we must highlight that there is a robust career ladder for lab professionals. Some of these opportunities require additional education and training, but they do exist and can be rewarding. So our data on workforce show that the field should also focus on diversity and inclusion. And we've taken steps to promote DEI by presenting at the 2021 AAMC Group on Diversity and Inclusion in Health Workforce Joint Conference. We've also tapped the ASCP Diversity, Equity, and Inclusion Committee that was established in 2019. We've appointed a diverse leadership to our Workforce Steering Committee, and that is also our goal for the coalition building. And we encourage the field to ramp up efforts internally and externally to promote our profession in primary and secondary schools with an emphasis on attracting underrepresented groups. And we also encourage the field to talk to their employer and assist employer efforts to increase workforce diversity. And this slide just shows ASCP's dedication to advancing diversity in the entire lab field, but this is not enough and we must do more. An expansion of the lab workforce must prioritize diversity and inclusion. And building awareness of the importance of DEI is a first step toward developing and implementing recruitment strategies that would reach students from underrepresented groups and also encourage them to pursue careers in the lab profession. It is also vital to provide resources to promote academic retention, especially among students who may be underprepared for their academic training programs. And similarly, it's important to help support the needs of existing lab personnel by providing opportunities for growth and addressing concerns such as burnout. And as I mentioned earlier, from our impact of culture and burnout study, that there is high rate of representation burnout among underrepresented minorities. And this also contributes to the staff departure. So another activity that we have been developing all year is the Career Workforce Lounge that will be at the annual meeting. In the past, its focus was mainly on resume building and mentorships, but we have expanded our offerings to include resources for both pathologists and lab professionals who are recruiting new employees, looking to expand their organizational development, culture and retention efforts, as well as resources to those who are seeking new employment. This year, we have a couple of educational sessions on peer to supervisor transitions, as well as best practices for recruiting a diverse workplace. We also have a couple of roundtable discussions on the Great Resignation and retention for labs and the burnout and work-life balance in the lab. For that one, me and Dr. Mulder will be in that roundtable discussion. And lastly, we will have in-person mentor sessions and mock interviews as well. So to close, overall, our participants in our study agree that a one-size-fits-all approach might not be the solution to the challenges faced by lab professions. And this study also revealed that while salary is the main sentiment we hear from many of our lab professionals, there are some issues unique to each occupational role that require targeted solutions. Our studies also suggest that a concerted effort by the field to outline the multiple career pathways in the lab would prevent students from missing these career opportunities. And also, purposeful recruitment by both educational institutions and employers is necessary to ensure diversity and inclusion in the field. Our studies also show that collective effort by numerous levels and groups of stakeholders, including lab employers, lab training programs, and professional organizations is needed. And lastly, I just want to invite everyone to attend or watch our workforce session at the annual meeting entitled Workforce Crisis, Time to Act. Our chair, Dr. Harrington, will be one of the speakers. Dr. Gregory Davis will be the moderator, and Dr. Sossaman will also be joining Dr. Harrington. So it'll be a great session, and hopefully you can all watch that or attend in person. And with that, I thank you, and I'm open for any questions.
Thank you, Edna. That was outstanding, as I knew it would be. Hi, everyone. I'm Rodney Rohde, and if you don't know me, I'm on the ASCP Workforce Steering Committee. Quite an honor, and I'm also a career ambassador. So I'm here today to moderate the questions, and we have a couple for you, Edna, that popped up. One of them's from Kyle, and he asks, is ASCP currently working on any effort to basically standardize, this is a nice question for you, to standardize and develop a single national license for laboratory professionals versus the state by state effort?
Thank you for that question, Rodney. Actually, we have here Matt Schultz, who is the lead on these topics. Matt, do you want to add on?
Yeah, I mean, the concept of a national license isn't entirely new, but it's not something we've really done much to explore on. And you've got CLIA, and then you've got state licensure, which often is kind of very similar to what's going on with CLIA. So I guess the answer really is no, there hasn't been any efforts really so far to try and kind of create like a standardized national license. But it's something I've been doing a little bit of dabbling, looking into. And so if you want to contact me, I'll give my email address here if you've got any questions specifically about this. And my email address is Matthew, M-A-T-T-H-E-W .Schultz, as you can see spelled on the screen, at ascp.org.
Yeah, thanks, Matthew. Appreciate that.
Sure.
Another participant has the question about and I believe this is about the actual workforce committee that you and I are on, Edna. Is it possible to join that committee at any time during the process? Feather asked that.
Yes, thank you, Heather. So we just formed this committee this year, and currently we have about 11 members. And I think one of the future goals would be to have a sort of like an advisory board, right, Ronnie, like type group. So we will have our core team, but we will have a subgroup of experts depending on topic. So we will probably open that maybe next year once we've established all of our activities, and we will ask for volunteers for those.
Yeah, the person that asked that mentions that she's a program director for HT in the California Bay Area and cannot keep up with filling positions, which I think a lot of us are experiencing. And yes, that Edna mentioned that there are subgroups. I'm co-chairing the subgroup for universities. So for example, we're looking at things like trying to get programs to change, including my own, from CLS to medical lab science programs to get more singularity with the title, including the credential, and other ways to maybe hit college advising, high school advising. So those are the types of things we're looking at, but we're also reaching, as Edna knows, down at the high schools and junior highs. And so there's subgroups that are kind of working on this. And it is a very challenging and complex problem, as all of you know. Those 9 recommendations will be something we're all working on ongoing, I'm sure. Not really a question per se, but I thought I might ask you, Ed, and I don't see any other questions in the Q&A and the chat, but I was curious if you've had any feedback around what I'm calling the free agency effect, where we're seeing lots of workers jumping to other places with huge signing bonuses and traveling, but then obviously leaving behind that kind of vacuum of experience. Have you seen any efforts at retention to try to help counterbalance that? It's just such a huge problem, I know, to deal with, but I'm just curious if ASCP's had any data there.
So in terms of retention, because it's blown up and we've seen so many leaving, right, because of higher sign-on bonuses elsewhere. I think what we've seen are retention pay, more retention pay. As I mentioned in one of the slides, they're also giving them flexible schedules. Those were the 2 common ones, but in terms of a like structured program or offerings, we really have not seen that, which I think would also be like a good topic to study and explore. Yeah,
I agree. I mean, that alone, I think is, it's a great thing that salaries and signing bonuses are happening for the medical lab, especially. I mean, I'm seeing that for my own students that just graduated. I mean, kind of wacky, 20K signing bonuses and things like that. We've never seen that in my 20 years, but the concern is that some of these are people that have, the 5 to 10 years of experience, and they're kind of leaving behind, some of that experience. It's just a challenge. You don't want to really hurt the awareness and the salary rise, but you also don't want to hurt your veterans that are so valuable, right?
And they're also seeing that the retention bonus is not as much as the bonus.
Yeah, it's a challenge.
Yeah.
I've got a comment here, more of a comment, and maybe we can talk about it, talking about everyone needs to really update and understand the eligibility requirements when hiring, because sometimes it seems like places will only look at generalist versus the specialist or categoricals. So, especially in a crisis, I totally agree with that. I think, we need to be very adaptable and considerate of people who might be an SBB or an SM, and maybe you can fill a need, even though you may want a generalist, but perhaps you can find a way to work with that up front to help with your shortages.
I agree.
Okay. Well, I don't see any other primary questions, but I'll let me check my Q&A. I have a Q&A question. Is it customary to have so few faculty members? Your presentation say the average is 0 to 5. Is it customary to have so few faculty members? Your presentation says the average is 0 to 5. I'm wondering if that's about actual programs like mine versus the committee makeup. I'm thinking that's about programs.
I think, yeah, that's for the programs. And yeah, that was what the BOC reported.
Well, I will tell you, in my experience as an educator for 20 years, it is pretty common. I started in 02 with 3 of us. That included the chair, and we got it up to 5. And then during COVID, they cut a position. And so that's another issue, is crazy, right? During a pandemic to cut healthcare faculty, but it is happening. So I'm back down to 4 right now. And so that's an area.
Are you having challenges in recruiting?
Oh man, yeah, I've got one person retiring soon and another in the summer of 23, and I'm in a panic mode. I may have to switch from tenure track positions to clinical track, which opens up the opportunity a little more, but tenure track's really critical for research universities. So I'm just, it's going to be an interesting year or so dealing with that personally.
Wow.
Got a couple of other questions here. Bill asked, do you have any feedback on the proposal, oh boy, to include nursing degrees for high complexity testing?
Matt. Matt, you're on mute.
Sorry, I was trying to get the mute off. Yeah, so here's kind of what's going on. And there's going to be an update in e-policy that'll come out later this week. So the rule came out at the end of July that CMS put out there. It's a proposed rule that would recognize the nursing degree, the baccalaureate nursing degree, for high complexity testing. And it's down below. It's also recognized for moderate complexity and what have you. Not recognized for laboratory directors, technical supervisors, technical consultants. It's just for testing personnel. CMS gave us only 30 days to do the comment on this, which was really a tight period of time, given the fact that it was a pretty large rule. I mean, there was over 100 pages of text on the CLIA stuff alone. So we wrote a letter requesting an extension on the rule, and we got, I think, 23 groups to join on with us on this. And literally like the day before CMS was expecting all the comments to be due, which was supposed to be the 25th of August, they granted us an extension. So we had launched at the beginning of this an action alert trying to get folks involved and comment on this rule. And a ton of folks have done this. I think we're over 14,000 now. I'm forgetting the exact number, but I think we're over 16,000 right now. Anyway, so we've got that going on, the action alert that we're running. Plus, we've been working on our own comment letter. That was pretty much close to done. But now that we got an extension on the comment through the end of September, we're going to go back and look at some other areas of the rule that we really didn't get a chance to kind of dig into. We will be doing more work on the grassroots to try and get more people to weigh in on this issue. It's an important issue and one we need to get everyone engaged on if we hope to actually turn the rule around.
Yeah, thank you, Matt. I think that will be an ongoing thing for all of us, obviously, to stay on board with, as from awareness and advocacy as we kind of move forward. So I appreciate that answer. Let's see, have a few comments more than questions, Edna, about, perhaps research should also include looking at retention strategies.
For faculty.
Yeah, for faculty. I mean, that's something I'm interested in, obviously. And I just answered a question in the Q&A live for people, but if you're a program director, this is a whole, I keep talking about this, and Edna has heard me say this, I think it's its own national crisis. So we have the bench level problem across all areas, and we have faculty shortages as well. So this is an issue, right, going forward, because many of our faculty, you typically have tenured faculty. I have several of those, and I also have clinical faculty. Clinical faculty do heavy teaching and service. Tenure do a lot of research, but we all have to teach a lot. And so our faculty are different. Most people don't realize this, that in biology and chemistry and other things, you can have graduate students teach your labs and things. We can't do that. All right, so I still prep my own labs. I still teach my own labs, and I'm a chair, and I'm a tenure track, or I'm tenured now, but it is very challenging to find a faculty member that can kind of meet those types of requirements, especially when you can graduate now and probably make more than I can pay you as a faculty member. It's crazy world.
So, the Board of Certification actually conducts the survey for faculty. And I've spoken to our new BOC Executive Director, Amy Spitzka, and that they are going to continue conducting these surveys. So if you have any questions, you can email me as well, and I can relay her those questions or suggestions for the survey. I'm sure they would love to hear feedback as to what to include in the questionnaire for the next go round.
Yeah, great. That's great. Well, everything else is just comments about how amazing you were. And I would agree. I think this is really critical information. I would really urge you, if you're coming in person or virtually to the upcoming ASCP 100th celebration annual meeting, to really jump into that session with Susan Harrington. She's amazing. I can't wait to sit in it myself. I'll be there in person. So I'd love to talk with you guys. If you're there, if you want to chat about this process, I'd be happy to also try and help answer some questions. And those that I don't know, I'll be forwarding to Edna and the
Yes,
team.
and if you are going to be in the in-person annual meeting, I will be at the Career Services Lounge as well for the most part. So if you have any questions for me and want to talk to me in person, I'll be there, as well as and Matt.
Okay. And I think the last thing we can throw in here, and this might be for Devin or you, is will this recording be available at a different time?
Yes, hi, this is Devin here. Great question. It absolutely will be. We will notify everyone. It'll be available both on the ASCP annual meeting platform after the meeting, as well as separately on our Virtual Pathology Grand Rounds website. Stay tuned for more information on that.
Okay, well, I don't see any other questions, so I will turn it back to Devin and Edna and team.
Wonderful. Thank you so very much, Edna. What a great session. Thank you to all of the attendees for joining today. Thank you for your enthusiasm and questions. We look forward to seeing everyone next week at the ASCP annual meeting. Thank you.
Thanks, everybody.
Thank you, everyone.
Thank you.